Welcome to the Healing Pain Podcast with Dr. Joe Tatta. Each week, we interview top experts in physical therapy, pain science, and integrative pain care. You'll learn the most up-to-date information for treating and reversing persistent pain. This podcast is for educational purposes only and not intended to be used as personalized medical advice. And now, here's your host, Dr. Joe Tatta.
Hey there, friends. It's Dr. Joe. Welcome to this week's episode. This week, we're going to do something a little bit different. Instead of me interviewing someone, I'm going to share a really simple yet really powerful technique that will help you whether you're someone living with pain or whether you're a practitioner who treats people. So this exercise is called dropping an anchor. It's typically one of the very first techniques that I teach patients who suffer from pain or pain catastrophizing or having problems with difficult emotions or emotion dysregulation, anxiety, really any challenge that's coming up in the therapy room. Before we begin, we probably should just revisit the term pain catastrophizing and just review and identify what that means. So pain catastrophizing is the tendency to magnify the threat value of pain, to feel helpless in a context of pain, or the inability to inhibit pain-related thoughts in anticipation of a painful encounter. Now, that last part, the inability to inhibit pain-related thoughts in anticipation of a painful encounter, is what I'd like you to think about as we go into this episode. So think about someone who has chronic pain. Each time they come into your clinic, each time they come into the therapy room with you, they are in some way in anticipation that there may be some pain during that session. We're going to talk about pain. I may be moving, or I may be moving your arm. You may be experiencing pain. So it's a lot of pain-related thoughts that are happening in anticipation of a treatment session. That's why we're going to go through this dropping an anchor exercise today. Now, if you've taken my Act for Chronic Pain course, or you've taken my mindfulness-based pain relief certification, you'll be able to identify that this type of exercise fits squarely in the psychological process of contacting the present moment, although you'll also be able to identify some degree of cognitive diffusion. So cognitive diffusion is that idea of distancing from thoughts or separating from thoughts. You'll definitely see aspects of both of those during this exercise today. Now, there are lots of different ways you can drop an anchor. You can drop an anchor by focusing on your breath, by stretching, by focusing on the rise and fall of the diaphragm, looking around the room and fixating on a point, listening to sounds in the room. There are lots of different ways. You're going to hear all of those flavors today because I'm going to share a recording. It's about a 10-minute recording that I had with a client that I work with virtually. So this whole encounter here that I'm going to share with you with my client, Barbara, I have her permission to share this, is less than 10 minutes long. So it's about a 7-minute exercise. And then at the end of that exercise, I give Barbara about maybe 2 minutes just to debrief so we can talk through what she noticed and experienced during the activity. Probably the most common mistake I see both therapists as well as patients make with this type of exercise is they attempt to use it as a control or a distraction technique. So control and distraction techniques are very opposite of what happens in mindfulness and acceptance-based approaches to pain. Mindfulness and acceptance-based approaches involve helping you turn toward what's in the present moment with an openness and a curiosity, and not necessarily distract, eliminate, control, or avoid what's present. Okay, I invite you to participate and let's say play patient for a couple minutes. So if you're driving, you may want to pull over to the side of the road. If you're at home, just find a comfortable chair to sit in. Any chair will do. And if you're in the gym, hop off the treadmill or put the weights down and again, find a chair to join us. You can do this as an eyes open or an eyes closed exercise, doesn't matter. I personally enjoy eyes closed exercises. Most people do with regard to cognitive and mindfulness exercises like this. So if you're seated, all you have to do is just place your palms down on your lap, just relax your arms at your sides, and just gently begin to close your eyes. The exercise will be less than 10 minutes total. Okay, let's get ready. And I invite you to drop an anchor with us. Let's get started. Are you willing to do that with me today to start?
Sure.
Great. So you can do this eyes open or eyes closed, whatever's comfortable for you. If you're going to have your eyes open, what I suggest is you just look down toward the floor, like a foot or two in front of you. And if you're going to close your eyes, of course, you can just start to do that now and just close your eyes. Palms can just be gently placed on your lap. And make sure your back is against the chair there. You can have your feet on the floor or maybe even up on a ottoman or stool if you want, whatever's comfortable for you. And just take a moment to land here. Just let your body land and begin to relax. And just let your mind land and begin to relax. And as you've landed there, just start to deepen each inhalation and exhalation, nice and gently and naturally. No need to force the breath. Our body knows exactly what to do with breathing. Breathing in and breathing out, nice and easy. You may want to count with the breath, so you can just say inhaling 1 and 2, and exhaling 1 and 2. And breathing in and breathing out. And as you're breathing there, just focusing all your attention on the breath. You may center your attention on your belly as you feel your breath breathing in and out. Or you may center it on that little spot below your nose and above your lip, as you can feel the air enter in your nostrils and out. And just notice if the mind becomes chattery and starts to talk. And if that happens, I just want you to say to yourself, thank you, mind. And then just anchor right back to the moment where we're here, together, breathing. Sometimes thoughts come in. Sometimes a memory or an image will pop up. Sometimes it's a physical sensation in our body. Just say, thank you, mind. And then drop right back into the present moment here, connecting right back to your breath. I'll let you work with that for a couple moments. And now we'll slowly walk ourselves out of this, nice and easy. Turn your awareness to the sensation of sound and just notice the resonance and tone of my voice. And maybe something else in the room with you, another sound. See if there's something you can smell in the room, or maybe taste. You can start to wiggle your fingers and your toes a little bit. Feel the sensation of the clothes on your skin. And then when you're ready, nice and easy, letting some light in, you can peel your eyes open. And then just to debrief, if you can just tell me one thing that you observed during that experience.
Body sensations. Particularly it moves. Pain moves, but it's not necessarily unpleasant. It just, I feel it here, it's in the knee, it's here, it's there, it moves all around.
Right. So you have the awareness of many different body sensations. Pain is one of them.
Right.
There's some sensations in there that we might identify as more pleasant.
Yes, some are pleasant, yes.
And there's some that, I don't really like that one so much.
Right.
But there's this constant moving that's happening, right? All throughout these moments together, that was about 5 minutes maybe, that you're noticing how sensations are present and how they change.
And they change particularly when you take a deep breath.
Right. Breathing is a way to anchor back into the moment, kind of focus on something other than those sensations.
Yeah.
If the mind kind of pulls you away and draws your focus toward the sensation of feeling good, sometimes that happens during a meditation. You just want to kind of savor in those positive moments.
Yeah.
And then other times there's other thoughts and images that come in that are not so pleasant. And then we return, we drop that anchor right back into the present moment. Mm-hmm. Good. So I'd like you to just later on, maybe today, just reflect on the exercise we did and just think about how you can work that into just daily life, right? Mm-hmm. Oftentimes what I tell people is just this acronym STOP, S-T-O-P, and it literally just stands for stop, take a breath, observe thoughts, emotions, and sensations non-judgmentally, and then proceed. And that takes not even 10 seconds. You willing to give that a try today?
Yeah, I know. It's interesting that it's hard to not judge.
Right. So part of this is we're starting to learn how to experience, in many ways, the positive as well as the negative or unwanted emotions in a way without placing that evaluation or judgment or critique on it. Right. Good. Okay, I'm going to end this here. Thank you.
Thank you for listening to the Healing Pain Podcast with Dr. Joe Tatta. To subscribe to the podcast and learn more, visit Integrative Pain Science Institute.com. That's Integrative Pain Science Institute.com. Sign up to receive weekly updates, leave a review on iTunes, and share this episode with your friends.